Imagine you're an adult woman and you're pregnant, but you're not a pregnant mother living in the modern world. You're a pregnant woman living thousands of years ago. There are no modern hospitals, no medical treatment, no doctors, and not even advanced medical equipment. So how would you bring your baby into the world? Back then, your only hope was an experienced older woman known as a midwife. You're now 9 months pregnant. With each passing day, your belly grows heavier and your body becomes more painful. There are no hospitals, no doctors, and not even an ultrasound to tell you if your unborn baby is healthy. The only way to know your baby is okay is by feeling the tiny movements inside your womb. Night falls. Suddenly, the most terrifying moment of your life begins. In the middle of the night, powerful labor pains strike. At first, the contractions come every few minutes, but as time passes, they become stronger and more frequent. Then your water breaks. At that moment, you realize your baby is about to enter the world. Your entire family immediately panics. One person runs to find the experienced woman, the midwife. Someone starts a fire. Someone heats water. Someone gathers animal skins to keep your baby warm after birth. At this moment, everyone has only one goal, to keep both you and your baby alive. Finally, the midwife arrives. She has no medical degree. Her only qualification is years of experience. She knows that every birth is dangerous and that one small mistake could cost the life of a mother or her baby. Even so, you have no choice but to trust her. She comes to your side and calmly says, "Stay calm. Take slow, deep breaths." Then she gently places her hands on your belly. Using years of experience, she carefully feels the position of your baby. Within moments, she can tell whether your baby's head is facing downward or if something is wrong. Next, she explains what you must do during labor. She may ask you to squat, kneel, or in some cultures, sit on a simple wooden birthing stool. In other places, women held onto a strong tree branch or a hanging rope while pushing. Generations of experience had taught them that these positions often made childbirth easier. As labor continues, the pain becomes almost unbearable. Your body aches. You may begin to bleed. Your baby could suddenly shift into a dangerous position. Labor might continue for many long hours. The bleeding could become severe, and you might even lose consciousness. If everything goes well, your baby's head appears first, followed by the shoulders, and finally, the rest of the tiny body enters the world. Moments later, you hear the sound you've been desperately waiting for, your baby's first cry. Only then do you know your child has survived. The midwife carefully cuts the umbilical cord using a sharp piece of stone. You think the nightmare is finally over. But it isn't. After giving birth, you may lose a dangerous amount of blood. Your body is completely exhausted and you desperately need rest. But there is no hospital, no comfortable bed, and no medical care. Heavy bleeding alone could take your life. And even if you survive that, another deadly danger remains: infection. If an infection develops, your life is once again at risk. There are no antibiotics, no modern medicine, and no doctors. The midwife can only use herbs, leaves, roots, flowers, and other natural remedies passed down through generations. Sometimes they helped. Sometimes they didn't. If they failed, your chances of survival became much lower. For women living thousands of years ago, giving birth never truly ended when the baby arrived. Severe bleeding, infection, and other serious complications could still take their lives. Many children grew up without their mothers because childbirth was so dangerous. But there was one beautiful thing about those ancient communities. People were never alone. When a woman went into labor, everyone came to help. The entire family stood beside her. Today, if you're pregnant, you have hospitals, doctors, medicine, surgery, and advanced medical technology ready to protect you. But thousands of years ago, a pregnant woman's greatest strengths were her own courage, her family's support, and the experience of a single midwife. Many women lost their lives in that battle. Yet they still brought new life into the world. Because they did, humanity survived. Without those mothers, none of us would be here today. Now tell me, if you were a pregnant woman living thousands of years ago, do you think you could survive everything you just experienced? If you enjoy learning the real stories of ancient civilizations, don't forget to like this video, subscribe to the channel, and stay with us for more incredible stories from the past.